The governor of Texas announced his state will allow some businesses to reopen on Friday, joining a growing number of states that have begun to implement phased reopenings. Here to share his views on what states need to do before they can safely reopen is former U.S. Surgeon General and member of Vice President Biden's Public Health Advisory Committee, Dr. Vivek Murthy. Doctor, thanks for being with us. And we know a number of states easing the rules, beginning to slowly reopen. Do you believe that we are ready to do this?
Well, I think in most states in the country, we are still not at the point where we're able to open safely. And let's just admit, everybody wants to open. We're all struggling and hurting in various ways. We've got to open up quickly, but we've got to make sure that a few things are happening before we do that. That the number of new cases is declining significantly and for a prolonged period of time. And that we also have the testing, contact tracing, and hospital surge capacity so that we can identify infections and treat them if they develop further.
Dr. Murthy, let's talk about testing, because the president unveiled his plan to help states with that yesterday. It would send enough tests to screen at least 2% of their residents. But a Harvard study suggests in order to reopen the country, 2 to 6% of the population will need to have tests each day. What is your opinion?
Well, listen, right now we are doing just a fraction of the tests that we need to be doing each day. We need to be closer to 1 million tests a day that we're able to perform. And it's not just the number that's important, but it's also the distribution. We've got to make sure that all parts of the country have access to the tests and that the turnaround time is quick. If we don't have that, then it's essentially like flying blind. We are going to be opening up without the ability to effectively detect where infection may be surfacing. We can't detect it, we can't contain it, which means it will spread more quickly. And that's unfortunately what happened at the beginning of this surge in the United States.
Now, you have a new book that's out today. It's fairly appropriately named given the times we have. It's called Together, and it's about the power of human connection. Well, right now, we're all coping with the loss of our typical social lives. So talk about what effect that can have on us if we lose that human connection. What can it do to our health?
Well, one of the most surprising things I learned when I was Surgeon General from talking to people across the country was just how common and consequential loneliness is in so many of our lives. Over 22% of adults in the United States struggle with loneliness, and people who live with loneliness have an increased risk of heart disease, dementia, depression, anxiety, premature death, and even fragmented sleep. So this has powerful implications for our health. But there's a bright side to it as well, which is I realize that human connection, that our relationships are an extraordinarily powerful resource in our life. They can enable us to be healthier, to perform better in the workplace and school, and even dialogue more effectively in our communities, which we could sure use just about now. So even though we are in the midst of a social distancing experience that does not have to consign us to a social recession, I believe we have the opportunity to engineer a social revival in our lives and in society more broadly.
I love that. The positive side, you actually have 4 strategies to help avoid loneliness during these times. What are they?
So quite simply, spending 15 minutes a day with someone that you love, either via phone or video conference, is a powerful way to create a lifeline to the outside world. Second, making sure that the time you have with people counts and that it's high quality by reducing distraction, particularly from our devices, is essential. And third, looking for ways to serve is so essential, because I realized in the writing of this book that service is a powerful antidote to loneliness that shifts the focus from us to someone else, and also it reminds us that we have value to bring to the world. And finally, solitude. It's essential, particularly in moments of upheaval like right now, that we embrace a few moments of solitude during our day, time when we can allow the noise around us to settle, where we can refocus and reground ourselves.
Incredible advice. I just love listening to the sound of your voice. I already feel more peaceful and connected. Dr. Vivek Murthy, thank you so much for being with us today.
Thank you so much. Great to be with you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.